reasons why men have much more confidence. That means also the belly area, Manipura chakra, we call it in terms of chakras, more developed. For a man, it's much easier to walk in somewhere, even if you have a bigger belly, you still look in the mirror and you give yourself thumbs up, I'm, yeah. For a woman, oh my God, if a nail is just not there, oh, she would put herself down for the whole day, like a little incident that has to do with this perception. For example, when you isolate from the others, when you don't get access to no locality or to the power of love to connect and to expand, that's the easiest. When you forget about the meaning of your life, we get, especially what I noticed nowadays, that there's so much addiction to technology, right? And again, technology can be a tool. It's like you have a knife, you can use it to cut the bread, or you can use for other reasons, So we have to be extremely intelligent to use this tool. Especially now the AI is coming. The moment we want to take responsibility, the things change, the perspective on the things change. And then you can create your mental hygiene. That's where this starts, I think.
Valentina, thank you for joining us today. I'm very excited to talk to you and ask a whole bunch of questions. One of the first things I was interested in was how did you get into this field? Because you're an MD, medicine doctor, but you're also into the Eastern medicine side of things. So how exactly did that start?
It's a long story. So I'll try to keep it short. And also, usually I don't talk so much about my experience, but yeah, I know it can be a little bit inspiring for some
Yeah,
people,
definitely.
maybe. Because I grew up in Eastern Europe, in Romania, actually, and in a very strongly opinionated family of mainly doctors and priests. And then it was also a communist country at that time, So from a very, very early age, I really asked myself like serious questions. I was not an easy child. Like what is this really about, and how free we are as human beings, and then what is healing, what means to be healthy. I was very, very curious, and also what happens after that. And then also since I had the really awakened healing capacity in my hands since I was very, very, like maybe 2, 3, 4 years old,
Wow.
And that was very puzzling for my father and my mother. They were doctors, and they were, oh my God, what is happening, So I really asked myself all these questions, and because I was very hungry for deeper understanding. Yeah, due to this process of reincarnation, I guess, there's all this theory of reincarnation. I don't have to go into it, but I guess that's why I came curious. And then also I started to read at a very, very early age. So I was really curious. This was I think, the main keyword about me at that time until I started medicine. I was really burning of curiosity and also burning to integrate everything about the science of healing with spirituality. So as I said, I had also this priest in my family, and again, not easy child to deal with there, Yeah, and again, especially when my father, he was having multiple specializations in allopathy, but he had to admit, also my mother, that there is so much more to know about human beings. It's not just matter, Like for example, when I was placing my palms on painful areas of themselves or somebody, and then it was like almost immediate release of the symptoms, Or when later on I was playing with dreams uh, about my exams, so let's say also in the university, or they could see, for example, that I was fasting with water only so easily and was just getting more and more energetic and more clear. And also when I started to work as a doctor, so it was a very strong vitality, but in the same time that curiosity. So I have to say this curiosity always followed me, a curiosity and an aspiration to know more, to become more, to awaken the potential that I was feeling is there, and I still feel, thank God. So I think this should be with us forever. This kind of energies, if we have it, it's like you are putting wood on the fire. If if you don't have this kind of fire, then and also if I think that if you don't go through quantum leaps of transformation eventually, because life is not just ups and downs, It's taking seriously this purposive movement of consciousness and see that we can go through leaps of transformation. Then eventually you get through these stages of expansion of consciousness, and then you get more inspiration to continue. Otherwise, I don't think anybody can continue like that forever and ever, just with philosophical questions, unless you have hands-on experience. Yeah, hands-on, whether with the healing capacity in the hands, but also hands-on experience regarding, for example, the quantum leaps of the chakras. So again, it's lots of things to be said about my childhood. I went also through not easy times, also when I grew up, and of course I encountered love, and then I suffered, and then I got sick in different ways. You know, I put my immunity down. Even I went through Lyme disease. So all these things and more, you know, they helped me learn first of all to understand myself, and also as a woman, you know, as a human being also. And then I could work easily with others, you know, much easier. So that was my style, kind of, you know, hitting my head on the wall, like learning from my own experience more than just from other people's, you know, other people's may be wiser and learn by themselves without going through difficulties as well. But I went through both difficulties and also lots of grace. And I think many of the people here who are your audience, of course, you know, it's this mystery of life, of growth, of love, of healing. Yeah.
Mm.
Yeah.
Yeah, yeah, thank you. Um, One of the things you said there was very interesting, that when you were doing medicine, you had this vitality about you. Um, and it's fascinating because a lot of people, they have large bursts of energy and then the energy crashes. You could say the nervous system's burnout or it's dysregulated. I know you have a particularly interesting perception or understanding of what the nervous system is and how it interfaces with our mind and our body. Can you talk a little bit about that and maybe why some people burn out quickly and others can have vitality doing something and it seems like the energy never stops?
Hmm. Yeah, and I think I want to try to put it easier for everybody, you know, not necessarily to go to the mental health terms and all. But I can again say from my experience. So there were when I was working in emergency. That was what I liked the most when I was working in allopathy. So I just like to be in emergency, and I was, you know, this 24 hours working as a doctor, you know, and checking all the emergency cases and being open. So kind of for me, it was like the more I was there, it was like the more attentive I would be, the more expanded I would be. So I was easily doing like 3 shifts in a row. So I was kind of preferring to do that because somehow in me, the energy kept increasing. That was how I was built, you know. So there was this intensity about me when I was working in the hospital at that time. Then it transferred to other areas, but there was this intensity and vitality, as I said. Now, what I noticed also later on, especially, so when you become much more rational, yeah, much more into thinking, more into concepts, but maybe you don't take care of your other bodies, you know, the vital level, for example. Like, for example, if you would be doing a job where you're sitting and working on computer and just using your mind and only that, you know, that would cause a lack of vitality. And if you're attentive, you can feel this immediate, or if not, it will pile up and you're getting into the burning out condition. You know, when again, you're not able to doing and being, like Amit Goswami would put it. So when you're not, you know, you're too much into the do mode, which eventually will cause a stress, yeah? And you're tensing up without being aware what's happening in your body. Even the physical body would give a signal. The mental body will say, well, you will not be able to sleep well. You will feel contracted, but you may not realize and still push it without common sense. And again, I know this because I was there a lot, you know. So we have to watch these kind of tendencies, especially nowadays. There is a lot, encounters this syndrome of chronic fatigue, you know, and also in
Mm.
Chinese medicine and acupuncture, I think you had a lot of patients on this chronic fatigue, especially women, because also as a woman, I'm telling you, so if you are into science or uh, in the scientific world, which is still mainly men predominated, right? you are pushing yourself to prove yourself maybe and forget about your feminine side, for example. So that would be one way for a woman to get into the syndrome, I think, of chronic fatigue, for example, And
Mm.
then there are, you can do various blood tests and everything is fine. But actually, again, in acupuncture or in Ayurveda or in other areas, again, even in homeopathy, so you can take a deeper look at the person and check the pulse, check the tongue, check the situation, and check the lifestyle. Obviously, check if there are not unprocessed traumas in the background. So we are like the iceberg. We just see the tip of the iceberg. So I am also thinking like whenever we walk, along each other, we really don't know so much about another person, about ourselves. Like we are a whole universe, very, very complex. And, so it's very easy to get into this burnout or deep tiredness, let's say, when also, for example, when you isolate from the others, when you don't get access to no locality or to the power of love to connect and to expand, that's the easiest. When you forget about the meaning of your life, we get, especially what I noticed nowadays, that there's so much addiction to technology, right? And again, technology can be a tool. It's like you have a knife, you can use it to cut the bread, or you can use for other reasons. So we have to be extremely intelligent to use this tool. Especially now the AI is coming, somehow trying to make it easier. But we have to be very attentive, I think,
Yeah.
because yeah, yeah. Also, maybe also the dementia nowadays and Alzheimer even. It's in very, very early ages, so even earlier than 40s, even in the 30s or even 20, from what I read, it's possible nowadays to manifest this, because we don't like to make much efforts. And again, when we make efforts, we are doing it as a machine, not following the meaning and purpose of our lives, the qualities that we have. We don't even wonder about these things. Many times we just have to survive. Many times, obviously, the systems around us are to be blamed, but still, the moment we want to take responsibility, the things change, the perspective on the things change, and then you can create your mental hygiene. That's where this starts, I think.
Mm. That's really interesting because my next question to you is going to be about what could the average person do who's stuck in the intellect and they're in the mind-based loop? What could be some of the things they could do? And you just said once they start to take responsibility, then things can start changing. Do you feel like that's the first starting point for someone
Yeah.
wanting to get out of that mind-based loop?
I mean, for my patients and my students, what I recommend first is to do a journal. It's a very simple method, but not done because nowadays we only like tablets, computers. But just get a notebook. I'm always having here, and Amit also on the table. We always have a lot of notebooks to write. People forget to write and to read. Even just if the people would just go online and see what's happening when you stop reading books, it's amazing. So we are putting ourselves down. But if we understand that we are here, and even if we don't know, but if we can just accept it, that there should be a reason somewhere why we are here, there is a purposive evolutionary movement of consciousness. If we are accepting even that, then we can take a deep breath. Okay, let's see where I am, and then maybe you want to write down, if not every day, but every second, third day, what is expanding me, what is contracting me. Like maybe you start with that. And then kind of when you're walking, pay attention how you're walking. Are you walking like this all the time? Try to see, even if you don't know, because I know you are into Tai Chi, Qigong, and other practices. So I also love yoga practices, again, the most, various yoga practices or Tibetan practices. But Tai Chi and Qigong, they are fantastic. Even dancing, people can go to dance classes or anything to just move the body. Nowadays, I think I see really the tendency to sit and sit so much more, and then no wonder we get sad, because we are sitting and we are contracting here, and then you kind of just become aware of the contraction before you're getting into the cervical hernias that so many people have nowadays. So that's just one thing to become aware of the posture, but then also to become aware of what, for example, the abdominal area. So just, especially women, I noticed this. And even I noticed about me. So only after some years, when I paid attention And at some point, I even know when, I was traveling in a bus in the Himalayas, in a bus. And then suddenly I could feel how my belly was just relaxing, finally. You know, otherwise, I didn't even realize that there was this contraction there, even if I knew mentally. And I wasn't, then I said, I'm fine. No. So there is, in quantum science, we mentioned about the free, very studied brains that we have in the body, not just here, even if this one, obviously, we are not using only very little, but there's also brain, like neuron-like formations in the heart area. It's studied by HeartMath Institute, but it's also in the gut, so in the abdominal area. And I think that's a beginning. So even now, however we are sitting, we just pay attention and relax the abdomen on purpose. You can place your palms on the belly, for example, and just again keep the back straight and simply make a deeper breath, breath, abdominal breath, kind of allow the diaphragm to also move up and down with your breath so that you can feel that you're relaxing the abdomen when you're breathing. That will be the beginning. Because usually we are breathing clavicular. And you wouldn't think it's such a big thing, but it is because we are keeping ourselves in this do and stress mode because we are breathing very, very superficial. Now, it's a lot of study about what we call pranayama or just breath, how important it is and how things are changing when you just, again, you relax the abdomen, do abdominal breathing, and then possibly thoracic breathing as well, just expand the rib cage, and then clavicular breathing. And then if you can hold it a little bit and then exhale, even exhaling, for example, if there's a stress situation, again, there are various practices like kind of just allow the exhaling part to be 2 times longer than the inhaling. Because there's a lot of residual air, especially if we live in a polluted area. Now we are in India, so there is pollution, I can tell, Maybe for you, you're lucky now.
Yeah.
But yeah, so this breathing is essential, it's the energy of life. Even just breathing can bring us in the present moment. Like there is an example which I like very much again to give to my students and patients. It's called the stop technique. Yeah. So the stop technique, because otherwise we are caught in this never-ending vicious circle, like a ruminating cows, on and on with the same thoughts. But how can you're getting bored even yourself when you're starting to notice all these unfinished thoughts, or not satisfied experience and so many things. All these things are going to be there. That's what part of what I call mental hygiene. And the thing is that we are taking a bath, we are cleaning our house, but what we do in the mental level, with the emotional level, that's even more important, and we don't do much, unless you learn not just about the positive thinking. Eventually, yes, we need to bring thoughts and emotion that would be positive and expanding. That's our job, because the brain will always throw the negative there. But again, when we become aware of the situation, that what exists in the brain is the negative usually, it's very little the positive, and it's our responsibility to create the positive. Yeah. So once we are aware about the situation, then we start, for example, practice of forgiveness. Yeah. So like, for example, when you finish the day, you finish the day with simply allowing yourself to stay with yourself, attentive to your breath, with the back straight, even for 2 minutes. Just breathe in and out, attention to the breath. Yeah. And then maybe again, you just scan your body and see if you're contracted in various areas, and accept yourself and allow yourself, allow yourself to be forgiven by yourself, to not fall into this trap of criticism, which is again specific to women. We criticize ourselves so much, so that's why
Mm.
it's obvious. It's one of the things why men have much more confidence. That means also the belly area, Manipura chakra, we call it in terms of chakras, more developed. For a man, it's much easier to walk in somewhere, even if you have a bigger belly, you still look in the mirror and you give yourself thumbs up, I'm, yeah. For a woman, oh my God, if a nail is just not there, oh, she would put herself down for the whole day, like a little incident that has to do with this perception. There's more, but again, it starts at the level of Manipura chakra, at the belly, I would think.
Mm.
And then I was telling you about this practice of the stop technique. If you heard about Osho, about Osho, he was using this kind of technique. So especially a person who is suffering, mental suffering or a disease or even cancer or any, so the more you give yourself this kind of stop techniques, the better the chances, because you would cut through, a negative pattern there in this way. So what you do, you can put your alarm, and of course, if you're not cooking something or if you're not crossing the street, so if it's a normal condition, you just, when you hear that, immediately you stop your flow of thinking. Yeah. No matter how good it is, you just stop it. Stop it and take a deep breath, keep the back straight, scan your body. It can take even 1 minute, all this only. And again, if you see tensions or you straighten up your spine, relax the belly, relax the shoulders, and then bring up 3 reasons for which you're grateful right now. So it can be the fact that you have 2 hands, you have 2 legs, that you have internet, that you have hot water, that you have water at all, that you have somebody in your life. We take so many things for granted. And as you know, again, gratitude is another practice. So these things are very, very simple. Speaking about gratitude, about love, about forgiveness, they seem very simple because they are so human. So, but still, so I had a lot of discussions along this more than 10 years since I'm working with Amit on quantum science, because that was an important point for me when I met him and when we started to develop courses. So so we're talking that people who are much more into ration. So it may be more difficult to open the hearts afterwards. So it
Mm.
would be better if you no, not better, because everybody's made in their own style, but just again to become aware that we have various compartments, that we have various bodies that we need to nourish. And then again, if we just lose so many moments on the thinking, or doing, without allowing ourselves to expand, without allowing ourselves to incubate, or walks in the nature, without experiencing this expansion of consciousness. No, what can you do? You just end up as an old, grumpy person instead, instead of allowing yourself to regenerate and to get more creativity and more emotional maturity with the passing of the years and so on. Now I'm talking so much, my God, because there are so
Oh,
many things to
it's
say.
good. It's great. One of the things you said, I'll try to be quick because it leads on to that. If someone's never heard of the chakra system before and they've only heard of Western medicine, because
Mhm,
this leads into another question I have about men and women, what would you
mhm.
explain the chakra system as to someone living in the West?
Yeah. Uh, and again, just to not forget, because I mean, my main topic could be like around preventive medicine, so understanding about chakras and all that I said, vital creativity, positive emotions, awaken physiology at the level of the chakras that I'll explain in a bit, quantum leaps at the chakras also, even, I mean, the discussion can go much further, is part of preventive medicine. So that there is this concept that we are, we have the capacity to heal ourselves, but we don't access it. So the more we will become aware of our potentials, of our structures, of how we are made, yeah, the better the chances to grow and to transform. So now we define chakras, if you want a quantum science definition, quantum science which integrates science and spirituality, because otherwise I can give you so many definitions also just from the yoga work and
No,
so
no,
on. But
your
quantum
quantum
science,
definition sounds great.
yeah. So it's describing the chakras as those places, in the body where consciousness simultaneously actualizes the vital and the physical, yeah, together, in the process in which the software programs are run, so the function, yeah, the organ function takes place, and then there's the correlated morphogenetic fields are moving. You heard about these morphogenetic fields, right?
Mm.
From Rupert Sheldrake's work. So, and then you feel that movement in the form of vital energy. Again, one will become sensitive. Yeah. So Rupert Sheldrake, again, so he introduced these morphogenetic fields in connection with the cell differentiation. Or again, in other words, chakras would be places where you can feel what you call the feeling in parallel to the energy activities that correspond to the main organ situated there. So we say that an organ is a vital physical combination, and that goes very well with the Chinese medicine and acupuncture, right? So we call the vital software the vital body. Yeah. So the memory that we make of our experience of the feelings of the chakras. If you want, I can look for a picture of the chakras about this. And then you will see that the chakras, the main chakras, because there are more chakras, are situated near one or more important organs of our bodies. Yeah. So this was noted for millennia, and it's a clue towards scientific understanding of the chakras. Yeah, because the vital body morphogenetic fields, they provide a blueprint for the epigenetic programs of the physiology that control organ functions. Yeah. So in this way, physical organs perform vital body functions, like for example, maintenance of the body or reproduction. Yeah. So you can also say that consciousness is using the morphogenetic field blueprints as a guidance in order to act on the organs so that the epigenetic physiology can change. So that is big, because allopathy, and science until now, it says that physiology cannot change. But again, there is so much experience. Even I had my own experience, but I had experience with even in my PhD thesis with various practices on people. So we used various devices to measure, like skio or biofield viewer. So it's important to understand the chakras because this way, that's the importance of the chakras. We have to understand how the positive emotions are made. Yeah, because if the chakras are not open and available, and if we don't have awareness on the chakras, we just talk about positive emotions from the brain only, as I said, being too rational. Because the only way we experience anything that's happening in your body, the possibility wave collapse only when they rise in the brain, in that case. Yeah. So, or you can say only when you sublimate in the brain and you manifest things. So again, it's always about what your brain is ready for, in this case of the rational thinking. But you never experience it in a pure feeling in the body and then a meaning. Yeah. So you got it. So usually it's like that. And you experience only when the unblocked energy is rising. But nothing new can enter that way because it's only the old. Yeah. So whatever is blocked, then unblocked, but it's still the old energy. You see what I'm saying? So it's the energy that maintains the organs. And that energy again is blocked when our organs are not maintained properly. So even when we get back to proper maintenance, it's still old energy, nothing new, but we keep ourselves in the same box there. And they are energies of the body collapsing in the brain through a process that is called sublimation in one way. Then in the spiritual traditions, you understand differently what is called sublimation, but this is the basic, the initial aspect. Now, the new positive emotions are not the positive emotions that you already had in your childhood and that are stored in the cortex. Yeah. So, because we have, as I said in the beginning, very few positive emotion circuits in the ACC, the anterior cingulate cortex. Yeah. So that's what we usually experience. But all of that is from the known, it's nothing new. And new is when it's different, like for example, you fall in love, romantic love is new. Like when you have feelings for each other and you manifest them, there's a new energy entering if you're sensitive, and momentarily you become expanded or exuberant, however you call it, and then you feel this in the body, in the heart, you feel it. Yeah. And new positive emotions, that's what transforms us. The old positive emotions are already there, but they are not enough. They will never be enough to balance the negative emotions that are inbuilt into the brain. This was the first thing that touched me when I studied quantum science with Amit, when I started to learn about this. So, like for example, people can apologize after they do something negative, but again, that's usually all positivity. It's not something that is transforming somebody. So new is different. New is something which transforms. And then again, my very favorite topic about the heart chakra. Heart chakra and heart, anahata chakra, we call it, is major for positive emotions. But then also courage is important. The belly area, it starts there. And both of them, because you wanted to ask about men and women, they're very important. If not, you don't speak about love, actually. It's going to be dependencies and so many aspects, dealing with the childhood problems. But love builds only when we also build this self-respect and self-love. And again, women, we have a lot of work to do usually, unless we become feminist, which is not feminine, you know. So
Mhm.
at the discussion there. But then again, so I mentioned heart chakra, Manipura chakra, and then Muladhara chakra at the base of the spine, and Svadhisthana chakra, the sexual area, where in so far we cannot say that it can be a quantum leap at these levels, because when you say quantum leap, that requires like a self, an experience. And that happens only starting the navel chakra, So I say transformation really starts there. Uh, or again, while lovemaking in a loving couple relationship, it can collapse in a positive way at the heart chakra. Yeah. So again, together with the sexual energy, when it's a love and polarity in that couple relationship, you can speak about the collapsing of the lower energies into the heart. Yeah. So again, the lower levels can collapse, being purified at the higher chakra. Yeah. Now, when you say the throat chakra, that's a bit different between the heart and the brain. So feelings at the throat chakra, they have a quality, So maybe you noticed the kind of feeling of exuberance that can be felt here. It's a feeling that comes from an accomplished expression of the heart. It's like a purity of expression, and also it can be a quantum leap of the brain here. So it's connected with quantum leaps or insights that take place. But when a quantum leap happens at the heart, it can manifest here as well, so in the throat. And when there's actually not discovered a big bundle of nerves sitting at the throat, so there's no literally brain like we discovered in other areas. Yeah. So again, scientifically speaking, we speak about this bundle of nerves, so neuron-like formations, thus brains, at the belly level, heart, cortex, and even parietal lobe. So there are some experiences. And then still, when you go further about chakras, the places where we feel vital energy movements associated with the programs that run the functions of the important organs of our body. So when you say creativity, because that's what, when you say vital energy, chakras, it's part of discussion about creativity, and that's the new. Yeah. So creativity of the vital physical body for a well person, it's a creative movement of vital energy beyond the conditioned movement of the vital physical ego persona. Yeah. So, and to energize all the chakras, in various ways, various techniques, it's a fundamental key to have a perfect physical and mental health, or to even think of awakening the latent potentialities and to accomplish what we want, and accelerate integration. So we take the aspect of yoga as integration, if you want. So the main thing is optimizing the function of all organs, all the chakras. Now, if you
Mm.
want, in the yogi tradition, there's other metaphorical descriptions that we can speak about. I don't know. Time
Yeah,
will
no, no, no,
tell.
that was great. Yeah,
Yeah.
connected to that, you said something quite interesting about feminism. I'm not interested in going to the debate so much, but it's interesting because it provides an example in society. There's so many things which seem like an inversion. People are trying to do something, but it ends up having the opposite effect. And I'm particularly interested in men and women right now because, like, I'm a young man, and then I see the disconnect between young men and women. And I know there's societal reasons for that, and like there's a lot of programming going on. But I was just wondering if you have any inclinations, like on an energetic level, why do you feel like there's such a disconnect between young men and women? Or maybe what do you think the weaknesses in the chakras or the energetic system could be?
Yeah, my dear, there are, and I love the subjects a lot. We can address it for a weekend at least. But there's okay, so let's make try. So there's a lot of male-female difference in the way we process feelings, for example, because usually men are more into thinking and more prone to have no awareness at all of the feelings in the body. Yeah, usually, yeah, there can be exceptions, but usually it's like that. That women feel not only what the brain is doing, but also the chakras in the body, and especially the heart. And this creates the first difference. It's a polarity, but it also creates an attraction. That's part of polarity, right? Attraction is important. Polarity is important. We, of course, now if we want a deeper discussion, we also have I have the inner man, you have the inner woman, as a man, I have the inner man as a woman. But the point is to also realize that I'm first of all a woman. Still, no, it won't be discussions here. But again, then there are all kind of obstructions that the brain can create. So materialistic, again, science, the materialists think that it's brain, that it's everything, except that the body carries out some vital functions, yeah, as a brain's extension. So this is the, the way the materialists are thinking, that the brain, okay, yes, the brain controls the body. Yeah. So nobody can deny that in let's say simple sex act, for example. For most people, it's the brain that guides the genitals, especially for men. But of course, not only women deny this emphasizing the role of the heart, but even many men experience a role played by the navel chakra even here. Yeah, it's not just the brain. So again, first the male-female brain difference. Again, so the neocortex, the cortical part, the thinking part of the neocortex is bigger. It's more massive for women. And in that way, neuroscientists usually say, well, this is why women talk more. You see what I'm doing? So I'm talking 90% of the time, you're just jumping 10%, even if you're the interviewer. So, but still, that's not a relevant story, especially it's not a story of love because women do talk more, but much of the talk is about love and relationships,
Mm.
in relation. But what they say, it's reflecting that they also feel in the heart and they value the feeling much more than the thinking in the brain. So it is even said that you cannot really understand women, you can only love them, you know that, right?
I like that.
So, so again, neuroscientists. So amygdala is connected with the right brain for men and with the left brain for women. And this is important because right brain is what is unconscious in us. The left brain is what is conscious. So, yeah, interesting because right brain is
Mm.
also the place where our spatial integration takes place. So, in other words, again, when men are looking for an address, then it's the right brain which is helpful, which men don't use much, But so, of course, men are not very good in finding addresses. They get lost and they refuse to believe this and admit, but it's true, right? So amygdala again is connected to the right brain in men, So what that does is that it gives men a privilege of having much of the negative emotion generated in the amygdala processed by the unconscious right brain. And that means that the capacity of suppressing emotion would be kind of effortless for men, even although they cannot cut off emotion completely since some of the right brain stuff leaks to the left because of the connecting tissue of the corpus callosum. So, but again, so men emphasize on reasoning, logic, rational thinking, and whereas for women, the amygdala connects to the left brain, which is conscious. So women are more concerned about emotions and they are expressing. Sometimes the problem is they are over expressing, that's another problem. But
Mm.
again, amygdala, yeah, it's bringing negative emotions. Yeah. So if you are, well, of course, it's not just negative, but it's bringing up the negative emotions. And if you are brain based, this is all that you will see. So again, men will scoff at women as those helpless creatures who suffer from being too emotional. Yeah. I mean, even speaking about vitality, so if a man is not vital enough, he would not be able to hold his ground when a woman is making a crisis there. Yeah, so he would be afraid. That's the first thing. You are afraid of intensity. You're afraid of this, all these emotions, because you cannot, collect. So,
Mm.
um, and still, this also becomes like the attractive part in a polar, man-women relationship. Um, so but then again, you have to ask yourself from where do feelings come from? Because maybe emotions don't originate in the brain as the materialist scientists are assuming. So and then you get to ask yourself about the science of feelings, what we call feelings, and the chakras again. Yeah.
Yeah.
So then there are male-female differences in how the two sexes process the chakras in the early development. Yeah. So there is so much so that in spiritual traditions, this is recognized as the male-female dichotomy. You know, you heard about this. So the main difference would be seen at the first glance uh, yeah, in the one in the brain, we spoke about this, yeah, and second at the body level, because again, the brain, women process emotion different than men, and then due to the way that our midbrain or amygdala connecting at the left brain, we express easily the emotion, sometimes too much, and then it's anxiety, right? And for men, it's the opposite, amygdala connecting to the unconscious right brain, and then the suppression of emotions. First of all, yeah. Second, neocortex is heavier in women, so the capacity to think and feel as well, yeah. Then at the body level, the heart, so women are more aware than men of their heart. So this maternal and romance qualities, and women care for the other in the relationship, right? That's the normal, yeah. And then second, the navel. The navel is the weak point in women. Therefore, all this dependency can occur easily unless we learn how to collapse the vital energy of this chakra. And then we enhance the self-trust, self-confidence, self-respect, self-acceptance, yeah.
Mm.
Then, okay, so this would be the most significant ones. But then there are, if you look deeper, there's so many, even at the body levels, how we are made, the men
Yeah.
compared to women.
Yeah.
Even, oh,
No.
even the level of orgasms, don't make me go into that. It's like at least 20 distinct forms of orgasms for women, when for men, it's not that range.
Yeah. Jealous.
I guess if Western society acknowledged that idea of a soul more, then would those differences be so severe? If I have an inner woman or my soul's more feminine, would we see such differences? You're talking about actual brains differences, but is the culture influencing the brain as well in that way? If it's all quantum, is my question.
What you wait second so that I can be sure I understand.
So say in Australia or a lot of Western countries, men are raised to repress their emotions, not be too feminine, but it's not acknowledged that we actually have an inner
Yeah,
feminine
I know, I
nature.
know. Okay, I got it,
Yeah.
I got it, I got
Yeah,
it.
you got that. So I was just
Yeah.
wondering, does that affect the brain on a material level? Is it just an evolutionary thing, or is it a quantum thing that makes these brain differences so far apart between men and women?
So again, still, I think that we have a lot of confusion nowadays in society, and this polarity kind of is decreasing. But again, if you're thinking of a further integration of ourselves as human beings, or you can think about anima and animus. So again, for you as a man, in your heart, there is anima. So that's the superior part of yourself is feminine, actually. So learning how to express your emotion, learning to allow yourself to be vulnerable, to love, to beauty, to everything. So this will be part of your growth. But in the same time, you have to preserve your masculine. Yeah. So
Yeah.
preserving your masculine, or me preserving my feminine, but in the same time allowing the masculine part to manifest. You understand? So both of them. And then again, in the various spiritual traditions, we talk about the awakening of the androgen eventually. But that's again, it's a deep discussion. There are various symbols. Ardhanarishvara in the Hindu tradition is described as one being, half man, half women, but perfectly awakened, and perfectly harmony there. Yeah, so and from my experience, and again also from what I studied, is that all our relations, they influence all this awakening of anima and animus. So if you look back into your relations, the persons that you are attracted to, so if you put back the qualities that you are attracted to, eventually maybe you realize that you have those qualities yourself. So the presence of another, all this alchemy of love, another big subject there. So it has a very healing role, but it has also a very big challenging role, obviously. But eventually it's great healing and geared towards this integration and awakening of our potentiality. So yes, together, so awakening both the feminine and the masculine in one being that would have eventually this integrational aspect, which is evolutionary, which is called the androgen. Yeah. But it has
Wow.
Ajna chakra, but that's another discussion there. So it's not a superficial matter there.
Mm. Um, One of the things I'm interested in hearing from your perspective, because you did Chinese medicine, acupuncture, and yoga, and you're also a Western medicine doctor. Well, how do you think Western and Eastern medicine will merge? What do you think that's going to look like in the next, 10 years and then 20 years?
Well, there is already a lot of alternative therapies that we have to understand how they work, And if you want, I don't know if you have this book, the Quantum Integrative Medicine, that Amit
Yep.
and wrote, So that's a sequel to the Quantum Doctor book that he wrote many, many years ago. And you will see a different interpretation that can be given to all these practices that are very powerful, and more people, at least those that I know, many doctors are nowadays more and more open to think of ourselves, not just as the physical body, you know. And even Ayurveda, if you think of Ayurveda, the Indian traditional medicine, it goes so many thousands of years back, together with yoga. And it's related to longevity. And it's so much integration that has been done already in Ayurveda, also in TCM. But speaking of Ayurveda, for example, it's non-material medicine system. We speak about the doshas, even if they are physical, caused by imbalances in the way we use non-physical vital energy as we grow up. So also herbal remedies, we learn how they work, not because of the matter content, but because of the efficacy of the vital energy to remedy the vital energy imbalance. So I think, so this is the way, I mean, you cannot continue thinking of medicine without taking in account the vital energy level at least. There are so a lot of evolution also on the mental health part. There are all these EFT, so people realizing that you need to learn how to clean all these blockages that appear.
Mm.
But at the same time, as you see, so even Ayurveda becomes more, just you have to be attentive, So even yoga and Ayurveda, they become like consumerist, So you still want to buy a medicine that would make the trick, So many times what I'm doing, and what I'm teaching to others is to look at the cause of the disease, to try to aim to look for the message of that particular imbalance, because I see it as a transformational message, whatever it's a suffering. Even if you go through a heartache, and there's a huge lesson there if it's affecting you right now, yeah. But making the step to become responsible, that would be the first step, yeah. And then learning how to go through it. But it's difficult because of all these negative emotional brain circuits there. When you suffer, there's a lot of stubbornness in the process. There's a lot of pride, even you may not think, you block your path to higher healings, to quantum healing, thinking that you don't deserve it actually. So all this very little, it seems to be very simple and too simple because the mind likes very complicated things. So again, even if we know a lot, I know a lot about all this Ayurveda, homeopathy, and so on, yeah. But still, so if you want to address the situation on the deeper level, you have to see what is that message there, you know, what is it? Because maybe somewhere you're blocking your evolution, so and then again you may just waste the chance of this life and even of these times that are difficult and they are critical, and otherwise you see that in crisis there can be a lot of growth actually, if you go properly and if you have at least one person to call your friend or your lover that you can be authentic with. So these little things, and then learn about the quantum leaps of transformation, and take it as again, not just again that you are going to take something, you're going to take a herbal remedy, you're going to take the best possible medicine in the world, that the money can buy, or you can get some hands-on healing, or even the best acupuncture treatment that will make you feel good maybe for a while. But if you keep yourself blocked for various reasons, if there is a trauma that you didn't work with, for example, or if you're really just too much into inertia, it's a major block. Yeah, we are just sitting, as I said. If we don't learn how to move this vital energy, that obviously the message is quite simple there. That there's a block that will manifest at the level of the organs, and it's not going to be enough to just take a powder, to just take anything that is fabulous. Even there are treatments with gold in Ayurveda, there are so many amazing treatments that yes, you can use, and I'm using, But in the same time, you have to become aware what is chi, what is prana, how to engage it, how to unblock your structure, and then how to prepare your mind to work with creativity, how to bring up the positive, how to ask yourself, what is the meaning of my life? Even if many times, again, if we go to deep sufferance, it may feel like it's just the dark night of the soul, which can last years, but there has to be a light at the tunnel. So again, that's the importance of having at least one person to be authentic with, having one friend that can be much more than all the gold in the world, having one hug. So, yeah.
Yeah, amazing. That feels like a good place to wrap it up. We covered a lot of stuff today, but I'm gonna have to rewatch this so I can
Yeah.
process it and find some stillness to go through it. But thank you so much for coming and talking with us.
Thank you so much. Yeah, I'm very happy. Your meeting you caused me so many things. I was even telling Amit just before, what will I tell these people? He said, yeah, you just start, then you will see. You'll be in the flow. So
Yeah, yeah.
you inspire me.
It was
Thank you.
totally in the flow. It was
Could I,
amazing.
could I ask one quick question? Maybe
Yes.
not a deep question, maybe, but going back to when you're talking about in the emergency department and
Mhm.
your energy was growing while maybe everyone would get tired after the first,
Mhm.
shift. Do you think everything you talked about in this episode, you sort of intuitively knew then? Like you're on your path, you're passionate, you're bringing these qualities to the job where other people might not have been?
Again, yeah, the things were working in
Yeah.
me, obviously, and also they are working in all of us. The things was working, and I think when we say yes to transformation, when you just say that's enthusiastic yes, again, even if we go through difficulties, but if there's this aspiration in our being, or if yeah, well, I had people to inspire me. You need to have some people to inspire you. But at that time, exactly, I didn't have like a particular person to inspire me. But all over my life, I was looking with wonderment, to people. It's called transfiguration. So I think this is helping. Like for example, I'm talking to you, and I'm getting this inspiration, enthusiasm, and a state of wonder. So this again, simple qualities. And then you're saying yes. You're saying yes to life. You're saying yes to growth. So even if again in my case I had a lot of bumping my head in the wall, I had to go myself through a lot of difficulties, but I went and I sit there and I went. I didn't give up. This thing, like not giving up and looking up, kind of looking up. Yes, yes, yes. So kind of have this aiming to connect with something inside of you, something inside of you, but also in the same time which is reflecting outside of you, and then you will see various synchronicities. So if you're on your soul path, you're seeing all the synchronicities. It can be a message on a panel, it can be how the wind blows and it's just bringing something, and then you're playing with that. So it's like it's a love game, I think. So all this game of life, especially when you feel all these synchronicities, you know that you're going very well, even when there are difficulties. So sometimes I was wondering, because there is this saying that God is not giving you more than you can take, and I was saying, I'm sure I must have been drunk when I planned all these things. It's not possible to carry, and still it was possible. But sometimes again, we may have a strong personality that needs a little bit of shaking there in the process. But
Nice.
we are not talking in quantum science, quantum spirituality about destroying the ego. That's again, it's going to be another discussion. We don't go into that like usually spiritual schools are saying you have to destroy the ego, destroy. No. So we are using the personalities, using the ego up to that point,
Yeah.
because you need the force in the process
Yeah.
eventually to become authentic, to become who you are.
Oh, great.
Wow, amazing.
So inspiring. Thank you.
Yeah,
Thank
thank you
you.
again. Incredible.
Perfect. Super,
All
my
right.
dear. I don't know what you're doing, but I think you're doing excellent and hope to keep in touch.
Yeah, yeah,
Definitely.
absolutely. We'll keep in touch. When this is all done, I'll send you a link to the video, and we'll keep making
Super.
short videos and send those to you too.
Great. And then let's be in touch. Who knows what
Yeah,
ideas
yeah,
can
absolutely. Sounds good.
come.
Sounds good.
Take care of you.
Thank you.
See you.
Bye.
Keep inspiring. Bye.
Bye.